Hi, welcome to the Kim Sunshine Show. I am here with an exciting businesswoman and a nurse practitioner. Her name is Lisa Magary, and she is opening up True Access Primary Care. And it's kind of a unique, new, innovative way to bring medicine to Flagler County. How are you doing today, Lisa?
I'm great. Thank you for having me. I appreciate it.
Awesome, awesome. So now you were running this type of practice in Gainesville.
Correct.
Okay, and what made you come to Palm Coast?
Well, I have had a house in Flagler Beach since 2019.
Yes.
And going through a divorce. And so things are a little, different. And so I love the practice model, and I know they need good medical care here in Flagler County. And I know what I do is special and is really good for the community.
Everybody needs good health care. So now what you're doing is different. It's what she's doing is not your average run-of-the-mill, same thing everyone else is doing. So tell us a little bit about your primary care and how it's different from what everybody's used to when they hear primary care.
Okay, so my practice style is direct primary care, and it's membership-based. For a low monthly fee, you get unlimited access. You don't have to use your insurance to use my practice. You can come, if you need to come 10 times a month, you can. We'll also have an on-site pharmacy with wholesale pricing. Yeah, and wholesale labs. So I know there's a lot of people that are self-employed. We work with a lot of realtors, and I know a lot of small businesses cannot afford to provide health insurance, but their employees need care. So we're a good option for that. So 80% of what happens in healthcare happens in primary care. And we are out there helping people get healthier and preventing them from needing more care. Now, people need insurance if you have to go to the hospital or something like that. But we take care of 80% in the clinic. So it's amazing.
80% of what's happening with a person, not 80% of the cost of the hospital.
Oh gosh. No, it's 99% less. I mean, for example, like a Z-Pak is $5.
Oh, really?
Yeah. So most medications, as long as they're generic, wholesale pricing.
Okay.
We don't make any money off of the medications from the pharmacy nor from the labs. All that stuff is wholesale.
So that's encouraging to me, because I always say if you follow the money, you can see what's going on sometimes. And they're not looking to make any money off of the medication. So now, do you have a philosophy with your care? With your style of care?
Absolutely. So the wonderful thing is you get care when you need it. It's not about the provider. It's about when the patient needs it.
Right.
So when you're traveling, say you go to New York and you get a stomach bug.
What do you do?
Right. You text me and say, Lisa, I'm in New York. I have a stomach bug. And I say, where in New York can I send a prescription so that you can start to feeling better, and go get some Gatorade, and I'll check on you in a few hours.
Right. Okay.
And you're done. That's it. And I, check on you a couple days later, make sure you made it home safe. It's like the old days, right? It's like where you actually get care and somebody cares about you and knows you.
Exactly.
It's like magic.
Yeah. So that is so cool. So you personally are the person who is seeing all of your patients.
Yes.
You're the person that they are in contact with. It's not like, sometimes when you walk into a doctor's office, you never know who you're going to get in the practice. And maybe A, B, C, D, or the new guy. Who knows?
Yeah. And as we grow, we'll continue to add providers. But yes, whoever is assigned to me will be with me, and, I'll be providing their care. And I was dealing with, a college student last night at 10:30 because she didn't get a note to her professor, and now she's in trouble. And
she got it, though.
Yeah, I took care of it. It's done.
She took care of it. How cool is that?
So her mom was happy. She was happy. And I was happy to do it. But, it's just how it goes sometimes.
So your patients actually get your cell phone?
Yeah.
Wow.
Yes.
Wow. So even back in the olden days, like you didn't get the cell phone for the doctor, you got the answering service number, and then they would patch you through. Nope. And the only reason I know that's because I worked at an answering service for a minute when I was 18.
Yeah. So it's actual care, right?
Okay.
It's like the easy button for healthcare. Right. I mean, I can tell you, I don't have experience with primary care in Flagler County, but I can't imagine it's much different than in Gainesville, where in 30 years, I couldn't find a primary that I liked. And then, you'd call, nobody calls you back, or you would call for a sick appointment and they'd say, I see you in 3 months. It's like, well, I'm going to be either, I don't know, dead or in the hospital by then. So it's care when you need it. So same day, next day appointments, lots of telemedicine, lots of texting, getting you taken care of, medication refills, labs when you need it, and, follow-up care.
So as a primary care doctor, are you able to work with insurances or no? With somebody, like, let's say I have an insurance and I cannot find a primary care that I like. Are you able to fill that gap?
For the monthly membership, anybody comes.
Okay, so you could be my primary care. And now, do they accept referrals from you?
Yep.
They do.
We can do referrals. Now, if you have an HMO, that's the key caveat. You have to at least meet the person that's assigned to you.
Okay.
So that we could get referrals done. But if you have a PPO, no problem. We can do
Okay.
referrals. You can use for radiology, use your insurance. If your insurance pays for your labs, you can get them drawn in my office, and we'll bill your insurance company, or Quest will bill your insurance company.
Okay.
So yeah, absolutely. I mean, 70% of our patients had insurance or healthcare sharing because we want people to have something.
So we see, a lot of people with Medicare and Medicaid in this area. And if they don't, so could you, isn't that supplemental? So explain how that might work in your scenario. If somebody has Medicare or Medicaid.
Okay. So Medicare, they just sign a waiver that says they understand we're not billing Medicare.
Okay.
So,
so for the primary care spots, they wouldn't be being billed for that. But if there's ever hospitalization or whatever, that would cover the major.
Yes.
Okay.
And we mostly work with small businesses. That's really where my passion is, because once we got started in this, the small business owners were like, "Can we do a corporate plan?" And I was like, "Sure." We didn't have a corporate.
Let's figure it out.
We didn't have a corporate plan, but we figured it out and, created one. And so now I've been doing that for a long time. We had over 200 businesses enrolled with us.
Okay.
And if your business has more than 5 employees, we waive the enrollment fee of $100 per person. So it's definitely a great deal to get your employees signed up.
So enrollment fee is $100 per person. And then what is the monthly fee? Does that go by your age or by how much care you need? Or
No,
is there a plan, or is it set for the same for everyone?
So it depends. If it's a corporate plan,
okay,
it's $60 a month per employee.
And that's for over 5 employees.
Even if you have 2 employees, you have to pay the enrollment fee if you don't have 2 enrolled.
Oh, gotcha. Okay.
But that's $60 a month. Kids are $30, and then spouses are, your mom or your aunt or whatever. If you're affiliated through a business, I'll let them in at the $60 a month.
Okay. And then what if it's a person who is just individual, they work for themselves, they're one person, they should still come in as the company one and just sign up their family?
If they're 1099, they can do that. Absolutely.
Oh, wow. Okay. So there you go for our local business owners who are looking for some health coverage, but not ready to take the dive on full medical insurance, or sometimes it's outside of the window that they allow you to sign up these days.
And healthcare sharing, you can enroll anytime. And I am very well versed in, and I have a lot of information on that as well, which is an alternative to insurance. It's a lot more affordable.
Okay, yeah. And is there anything else that you'd like for everybody to know about your program?
I'm very excited about this, and I'm excited to take care of everyone and make us a healthier community. So
do we have anyone in the area that's currently doing primary care the way that you're doing it? Are you familiar?
I think there's a few. One I went to grad school with. She's awesome. Her name's Lauren. I don't know the name of her practice. She's over in the Hammock.
Okay.
And I think there's one more, but I don't know her.
Okay, so there are a couple already here, and we just want to welcome Lisa to the community. She's experienced now. How long have you been doing this?
Doing what?
Direct care? No, direct care.
Okay, I was like, I've been a nurse practitioner since 2005, but I've been doing direct care for 7 years.
For 7 years. Excellent. So you know it backwards, forwards, and upside
I love it.
down.
It's magical. I used to say to people all the time, I'm like, I created my favorite job. Like, I love it. So, I get to see patients, and then I'm talking to business owners and learning all the people in the community, which is super fun for me. So yeah,
that's wonderful. That's wonderful. And, we just had an influx. I think 20, 30,000 people have just moved to Flagler County in the past year or two. So, yeah, you should have no problem filling up those roles, and just getting the word out to people.
There's one more thing. In a traditional practice, a practitioner is assigned around 4,000 patients. I will never have more than 600.
Oh, okay.
And when I get to 300, I hired another provider. I'll hire another provider. So it's not going to be one of those things as, it was really good when we first joined, and now I can't get a hold of anybody. It's not going to be like that, because we don't allow that. It's really about the experience.
So she only allows 600 people to have her direct cell phone number in flu season or cold season.
That's all right. I take care of you. I don't care. I do it. It's favorite.
So are there any trends that you're seeing right now as far as, or any advice that you could give to people to help them ward off? I mean, we know it's cold season, it's flu season, the stomach bug things going around. So what advice would you give to people to help prevent that? Like if they are going out in public somewhere. To
be as healthy as possible, cut your sugar intake. Definitely make sure you're monitoring your vitamin D. If your provider's not checking that, you need to ask them. Low vitamin D is linked to a lot of different cancers as well as frequent illnesses. So, and then if you feel like you might be getting sick, add in some zinc and some vitamin C to your vitamin D, and it'll shorten the duration.
Is this music to your ears or what? Like she is telling us what we can do to prevent getting sick. I love it. I love it. So isn't vitamin D free when we go in the sun for a minute?
It is. But what people don't know is if you wear contacts, glasses, or sunglasses, you're actually lowering the amount of vitamin D your body produces because the receptors are in your eyes. So if you're covering
Whoa, wait, back up. The receptors for the vitamin D are in our eyes?
Right. Yes.
Well, so blue-eyed people are like...
They can adapt.
Okay.
Over time. Not that, if someone has very light eyes, I tell them have an umbrella, but take it off and just let some sunlight. You don't ever look into the sun. Don't ever look into the sun.
Don't look directly in. It's not going to increase your vitamin D.
No, but if you have a baseball cap on and just take your glasses or sunglasses off just for even 10 to 15 minutes, you're going to synthesize your vitamin D better.
Wow. And how much time should a person spend in the sun? 15 minutes a day, you think?
Yeah, 15 minutes. Is that good? 15 to 30 minutes. Obviously start slow and no sunscreen in that 15 to 30 minutes. So wait to put your sunscreen on because it actually blocks vitamin D being made.
Wow, the sunscreen is blocking vitamin D too. Oh.
Yeah.
So I know some people who never go into the sun without sunglasses and they say it is because it hurts their eyes. Now, I have brown eyes. I have never experienced that. I feel weird with sunglasses. Like I just rarely wear sunglasses.
But just even 5 minutes, if they could do 5 minutes, they will adapt.
And is the evening sun or the morning sun or it doesn't matter? So
the best is in the morning, actually between 9 and 10 a.m., but most people are working, so that doesn't work.
So what if you go at 8? Then you need 20 minutes instead of 15? Yeah. Well, the sunrise is on the beach, and that's absolutely
gorgeous,
beautiful.
My favorite.
And you're probably not getting a whole lot of that vitamin D at that time,
not,
just because it's...
But you're feeling very zen inside because it's gorgeous.
Well, you're feeling great because you're grounding. Like, I go barefoot at the beach in the morning. I love it.
Grounding's
great. I love it. So I appreciate you so much, Lisa, and everything that you're doing and that you're coming to our community. We're so super excited. I've been praying for good people to come from the north, south, east, and west. And you are one from the west. So I'm so happy that you're coming here and starting a new practice. Great. And if you're interested in this type of medical care, which is out of the box, one of the things that I love are people who think out of the box, and this medical care is definitely out of the box. And as we can hear, Lisa, she's all about preventative care rather than just, hey, go ahead and get sick and live willy-nilly and then come see me. So I love this thing with sugar. So what are you suggesting if people have a sweet tooth? Like, what should they do? Like, it's Christmas cookie season. Like, what do we get into?
I know, but there's always going to be something where you could eat a bunch of sugar. I would say if you don't have self-control, you just have to not.
Don't do it. Okay.
Like one day, say, I will have something sweet one day a week. If you're somebody who has self-control, who can have one is not going to hurt you. It's a plate of cookies every day. It's the consistent intake of sugar,
got
right?
you.
And plenty of water. And sugary drinks are worse.
So what about like sugar in my coffee? Like I cut out soda a long time ago. I wish everybody, if you're on a diet of soda, like it is not good for you whatsoever.
Diet soda as well. I don't drink any soda, but
diet soda is worse than regular soda. Yes. It is worse. I mean, it'll block your receptors from noticing that you're full. So even because you're diet, and they're like, haha, we got this one, and it's a shame. Follow the money. And okay, so I like sugar in my coffee.
Yeah. I mean, how many cups of coffee do you?
A lot.
Okay.
I don't know. I bounce off the walls all day, but probably 3 or 4 a day at least.
And how much sugar?
1 tablespoon. I should put that in there.
Which is 3 teaspoons.
Okay.
I don't know. You can
3 teaspoons. Okay.
Because 3 teaspoons is a tablespoon.
Hey, you're right.
So you could put that into one of the apps and just see how many grams of sugar that is a day. And if it's a lot, then cut it back to half a tablespoon.
Half of that.
Or an alternative.
Well, I did do like black coffee for a minute. Like I was able to
maybe alternating. I don't know,
but I love my sugar in my coffee. Okay, so I have one more crazy question because we're all of us are watching TikTok now, and I saw on TikTok this crazy thing, right?
Okay,
so I was like, okay, if you can get that baking soda to the cancer cells hidden in maple syrup or honey, that the honey or maple syrup is going to be attracted to cancer because cancer loves sugar, but then the baking soda is going to change the pH and kill it. Is this even anywhere near something that could possibly be?
So they've been theorizing this for a long time.
Oh, really?
Yes. Trying to figure out how to get the area around the cancer either acidic or basic.
Right.
And that's a base, right?
Right.
Baking soda is a base. And so
you're the doctor.
So
she's like asking me.
No,
she's the doctor.
Yeah. And so that's what they're saying is if you could get the area around it, and the sugar in the honey carrying it there, but I don't think it's been proven like clinically in a clinical setting.
Okay.
So, but is it going to hurt you to do baking soda in your honey?
Yeah, that was my question.
Absolutely not.
The
Go
next
ahead,
thing
do it.
I'm doing is looking up how much baking soda, not that I have anything to do with cancer, but I'm looking up how much baking soda is like dangerous. And they're like, oh no, you could take a tablespoon of baking soda a day.
Fine. Yeah.
So yeah.
Yeah, you're not going to hurt anything.
So it won't hurt anything. So let's try it and see what happens. Anyways,
not?
I thought that was an interesting thing.
There's all kinds. Well, that's the scary thing about TikTok.
Oh yeah, because there's all kinds of crazy stuff too.
Yes, so
yeah,
you gotta be careful who you listen to.
Well,
so you have to have a trusted grown up that's a clinician that can help you guide you on this.
I have one now, Lisa. Lisa Magary, with the True Access Primary Care. So you don't mind answering questions like that when people are coming with like these holistic things, like if I'm doing a tincture of apple cider vinegar and the turmeric.
I just tell people with apple cider vinegar, be careful because it can eat away at the enamel.
It's going to eat away at your teeth. Exactly. So get a straw.
Really right. It's really
get a straw.
It's people say they get a lot of benefit out of it, and I think it tastes nasty, but if it makes you happy and you feel like you feel better on it, then do it. But just be careful with your teeth.
And it's supposed to be the one with the mother in it if you're going to do it.
Yes, exactly.
So it's supposed to be the one with the mother because it has the
Bragg's
enzymes
is the best.
in it. Yeah, Bragg's is the best. But it's supposed to break down the crystals in your joints. Like that was when I looked into that.
Yeah.
And I read the book and it's like, oh, we can do everything.
Right,
and I was like, yes, it does take the grease off the counter. No. but it's supposed to break down any acid crystals that you build up in your joints and cartilage. And that's one of the big things that the apple cider vinegar does. And it's just funny because it's so sour and then you're thinking the acid and how's that breaking that down? You'd think it would be the other way around, but it's just interesting.
That's good. Yeah. I mean, I love that stuff. When I worked in traditional medicine, I realized that writing people prescriptions all the time wasn't helping them. It wasn't fixing them. It was creating dependency.
Right.
So if people are open to it, I'm happy to teach them alternatives and ways to get better, to help reverse diabetes and all that kind of stuff. And it's just with nutrition and exercise, but not everybody wants to do that. Some people want a pill and they want to do what they want to do. And
exactly.
I love them too, but I'm happy to help if somebody wants to go on a health journey.
Okay. Excellent. I'm so glad to hear that. See how awesome she is. I knew she was awesome sauce.
Oh, thanks.
So what about coconut oil? So that's another one that we hear is
it's good for teeth too. You can do oil pulling. And you put
oil pooling or pooling?
It's called oil pulling, Pulling.
Okay.
But it's like a teaspoon. I can't do it. It makes me gag, but people do this. It helps pull all this stuff, like kind of cleans your teeth. It pulls the bacteria and helps break down the tartar. And anyway.
You know what I do with mine?
Option.
So I brush my teeth normal with my toothpaste, but then I have some coconut oil nearby. Yeah. And I brush, and it will get all of everything in between, and you got that nice clear. It's wonderful. So I really like doing that, and I've been doing that for a long time. So love it.
There's all kinds of stuff out there to do.
Oh man, Lisa, I would love for you to do a little newsletter on that, and let's get everybody signed up. So I'm going to be sharing links to information about Lisa as she's getting her practice together. So we do not have a location yet.
Working on it. I'm hoping today that phone call that you made.
Yes,
Please.
that we can work on getting her. But she's looking to be in business in January. So we are looking forward to helping you grow your practice. So if you are interested, just check the comments. We'll keep it updated as Lisa grows. And welcome to Flagler County.
Woo-woo. Yes, thank you. Thank you so much. This is so fun.
You're welcome. Is there anything else you want to let everybody else know?
No, I'm just happy to help, and I'm excited to be here, and I can't wait to get to know you.
Awesome. Everybody have a great day. Thanks for tuning in to the Kim Sunshine Show.